arrive at Children's Hospital and Medical Center, your day begins at the Access Center. You'll be asked to get here at least 2 hours before your surgery time. You will check in and receive your name band. The medical staff will check this band throughout your visit to ensure your safety.
Thank you.
You can take 2 caregivers with you to the CARES unit. A child care partner will meet you and take you back. Along the way, she will take your height and weight and show you to your room.
So I just have you sit here on the bed.
CARES stands for Children's Ambulatory Recovery and Express Services. This is the outpatient surgery department. Once you are in your room, you will meet your pre-op nurse. She will take care of you before your surgery. Although your doctor already knows your medical history, it's important for your nurse to review this information with you and your family in case there are changes. Children's encourages you to be part of this conversation and help your caregivers answer these questions. After the nurse is done with your intake questions, it's time for you to change into a hospital gown. You may have to clean your skin with CHG wipes.
Put on your gown and I'll be back with a warm blanket.
These special wipes help to prevent infection and the spread of germs during certain surgeries. The type of surgery or procedure you have will determine whether you need to do this. Be prepared, your skin might feel wet and sticky for a few minutes.
Hey, Jasmine. Good to see you again.
Your surgeon is the doctor who will perform your surgery. In CARES, your surgeon will talk you through the surgery plan and mark the surgery site. This is a good time for you and your caregivers to ask any additional questions that you may have. The anesthesiologist is another doctor. He or she will decide your anesthesia plan. Anesthesia is medicine that helps you fall asleep and stay asleep. It also helps prevent you from feeling any pain during your surgery or procedure. This doctor will also stop the medicine when your operation is complete and you slowly begin to wake up. There are 2 different ways for you to receive the anesthesia medicine, through a mask or through an IV. Your anesthesiologist will talk with you and your family about the safest option for you. Child life specialists are other important members of the surgery care team. They are professionals who help patients and families understand and cope with the hospital environment. They may show you the mask that goes over your mouth and nose so you can breathe in the anesthesia medicine. Or an IV. It's like a small straw that's placed in one of your veins to allow the anesthesia medicine to go directly into your body. If you need an IV, the child life specialist can help you know what to expect and suggest ways to control pain so you don't feel the poke as much. Very soon now, you will head into the operating room. A lot of people ask what it looks like inside an OR at Children's. Large lights over the operating room table make sure the surgeon and the OR team can see everything clearly. There's also an OR bed and an anesthesia machine right by the OR table, along with separate tables that have sterile coverings. This is where the OR team puts all of the tools the surgeon will need to keep them safe and clean. When it's time to go to the OR, your pre-op nurse will relay important medical information about you to the operating room nurse. The OR nurse is the person who will take you in your bed to the operating room. This nurse stays in the OR and takes care of you during your procedure. Once you're in the OR, your surgical team will check on you constantly. They monitor your blood pressure, your heart rate, and your breathing. The anesthesiologist will also start the medicine that helps you fall asleep. Patients often say the medicine makes them feel tired and a little dizzy, but many don't even remember falling asleep. When your surgery or procedure is complete, you will move to the recovery room. This is the post-anesthesia care unit, or PACU. One caregiver can be with you in the PACU. As you wake up, you may still feel sleepy and want to keep resting. Your PACU nurse will continue taking your vitals, offer you something to drink, and ask if you have any pain.
Can you give me a number to describe your pain?
If you are feeling uncomfortable, tell your nurse so they can provide you with pain medicine. Nurses are always assessing your pain and providing medication to keep you as comfortable as possible. Each doctor has different goals they want patients to meet before going home. Some examples include drinking fluids, maintaining a manageable pain level, and staying awake long enough to have a conversation. To meet these goals, patients return to the CARES unit to continue their recovery process with their pre-op nurse. Your nurse will continue to assess your pain and monitor your vitals. If you need a longer recovery time, you may be transferred to the surgical observation unit or to an inpatient unit. Before you can leave the hospital, your nurse will review discharge instructions with you and your caregivers. These instructions include how to continue managing pain as well as post-anesthesia symptoms. This is another good opportunity for you and your caregivers to ask any questions. After you've changed back into your own clothes, it's time to leave. The child care partner helps you and your caregivers back to the atrium. Most patients need to ride in a wheelchair in order to keep them safe, just in case they're a little wobbly on their feet. Your time at Children's is complete. Thanks for letting the team here take care of you.
We are the 2017 Teen Advisory Council.
We hope this video helped alleviate your stress by showing you what to expect when you come in for surgery.
Thanks for watching.
We
hope you enjoyed it.